So we're talking about flu shots, and I did have mine.
I had mine.
Yeah, I was going to ask, when did you have yours?
I had mine about 2 or 3 weeks ago. I'm not normally that on it, but I have asthma. So I was really, as soon as they came in this time, I had mine immediately.
So do you also get the pneumonia shot schedule that a lot of people with asthma have?
Yep, I get the pneumonia shot as well. So that's every 5 years. So luckily, I'm within my time right now. So
okay. So Dr. Dawson, why it's on your website, and I think it's a really good question. But it says now more than ever, it's important to get your flu shot this year to protect yourself from the disease. Why is it more important now than ever?
I mean, the big thing for this year as compared to years in the past is that COVID's here. You know, we have COVID, which is a very deadly disease, especially for our community. And so if we protect ourselves from the flu, it doesn't prevent us from getting COVID, but it actually is helping us not get the flu. What you don't want is a super infection. So you don't want the flu, then get sicker because you then contract pneumonia or COVID, and then, you know, it could lead to anything at this point. So my big thing is if we can prevent ourselves from getting the flu, we're doing ourselves a favor.
Who among us should get a flu shot?
Everybody. So from babies to elderly.
Pregnant women?
It's safe and effective. So everybody should get a flu shot.
So pregnant women?
Pregnant women as well. And so I believe it is within the first 2 trimesters. They don't want to give it to you, but then they give it within the 3rd. And so going ahead and getting your flu shot is huge right now.
So what does a flu shot do and what does a flu shot not do?
So the flu shot is not going to give you the flu. That's a big myth. It can give you some responses. You can respond to the flu shot to the point where you can feel a little sick for a day, stomach may hurt for a day, but it's not giving you the flu. What it's doing is it builds antibodies to the flu. And so those antibodies is what fights the flu. You're not getting a live virus. You're getting an antibody, which is going to boost your immunity to getting the flu. And so a lot of people say, I feel bad when you gave me that flu shot. Well, you may feel not the best, but it's definitely not giving you the flu.
So how long after you take the flu shot before it's fully up and ready to go, fully out there? Because I've heard anything from it takes a week to become, to get in full effect. It takes 2 weeks. So after you get that shot, how long should you start to see the benefits?
2 weeks. So the average from CDC is that within 2 weeks, you should start having that benefit that the antibodies have boosted your immune system to it.
So if you start to feel a little icky within that 2 week time period, it's not the flu. It's just your body adjusting to the vaccine.
You got it.
Wow. Okay. So where can most people get a flu shot? Do you have to specifically make an appointment at your doctor's office and go in and worry about exposing yourself along the way or on the way back to whatever to go? Is there any other way that you can get a flu shot? How should people go about it?
So the big things is absolutely you can go to your doctor's office. So you can call your primary care doctor, make an appointment, get a flu shot. A lot of doctors' offices have what we call nurse visits, which puts you at limited risk. Sometimes we bring in healthy people in the morning instead of in the afternoon. We have sicker patients just to get their flu shot. So that's one. The other is your local pharmacy. So you have CVS, Walgreens by you. They also will give flu shots and put you in decreased risk. What we've done this year with IU Health is we're also having, I believe, 4 clinics, and don't ask me where because I don't know the exact locations, but there's 4 clinics that will be free. And so we also know that COVID not only affects us in the way that we've gotten sick and it's affected our community in that way, but also we've lost a lot of jobs to COVID. And so some of us, don't have the money to afford flu shots this year. So we're having some free clinics around the city this year in your communities to kind of help get people the flu shot.
So is it safe to get a flu shot during the pandemic? It's safe to go wherever you need to go to get a flu shot?
Absolutely. Wear your mask, stay away from people, make sure you have some hand sanitizer and go get your flu shot.
So again, the question of will a flu shot protect you from COVID? It won't protect you from COVID, or will it protect you from COVID?
It will not protect you from COVID. And so that's a misnomer. It actually, there was a study done in January of 2020 that actually showed that the flu shot, if you got the flu shot, increase your risk of COVID, but that study, it has been shown to be false. However, it won't protect you from COVID. What it will do is prevent you from getting the flu while we have the COVID pandemic, which puts you at increased risk.
So how will we know? Because we're heading into the heavy allergy season, the influenza season, and of course, COVID has been here and just kind of camped out for quite a while. So how will we know the difference between allergies, a cold, the flu, and COVID-19?
So the big difference is colds and allergies don't tend to give fevers, whereas flu and COVID will tend to give you fevers. So you think of fevers, chills, not being able to get out of bed, extreme fatigue. Think, ooh, I could have the flu or I could have COVID, as compared to like the cold. Yes, you're coughing, you're sniffly, but you might not necessarily feel like you can't run your errands or go to work. The big thing with COVID, though, is that you don't know if you have COVID till you get tested for COVID. So if you're having symptoms of, cough, even without a fever and just not feeling the best, go ahead and get tested. It's not going to hurt you to go get tested. There's a lot of drive-through tests that we've had throughout the community. Go ahead and get a test and just make sure you don't have COVID. And so with the flu especially, you tend to get a fever with it, whereas COVID, you may not.
Yeah. On a scale of 1 to 10, I guess this will be my final question, Doctor, because you've answered all these questions beautifully. And hey, you put it out there just exactly in a way that everybody can understand. And I do appreciate that. On a scale of 1 to 10, how important is it for people to get their flu shots and why?
On a scale of 1 to 10 this year, a 10. Mm-hmm. Normally I, of course, will offer the flu shot, and I'm really a big proponent of it. I have asthma, so I have a comorbidity. So I'm always going to tell patients, hey, if you have a comorbidity, hypertension, asthma, COPD, go ahead and get your flu shot. It's not going to hurt you. But this year, especially with COVID being so rampant in our communities, especially over the last weekend, we have seen that our COVID tests have jumped. Our positivity rate has jumped from 4.4 to 8.8%. We doubled in a weekend. And so we know COVID is here. It's not going away. But if we can protect ourselves from at least one virus that can become deadly, because the flu can still become deadly. It's not as deadly as COVID, but it still can be deadly. If we can protect ourselves from one, being the flu, we at least give ourselves a chance.
Indeed. And you know what? I have to sneak a real quick question. I said that was the last one.
Oh, you can ask whatever.
Okay. Is there any truth to the fact that perhaps the flu season this year, this particular season, is going to be lessened in part because of all the precautions people are taking with COVID, with the masking and the additional washing of hands and the social distancing, which, by the way, also contribute to not doing those things, also contribute to catching the flu. Is there any truth to that at all?
Absolutely. So studies have come from Australia. Yep. Studies have come from Australia that if they were social distancing, their flu season started before ours. And so with their social distancing and their mask wearing, they've actually seen a decrease in the flu. So we've already seen that in other cultures and communities. And so we know that that is potentially true, but we've got to be wearing our masks. We've got to be making sure we're washing our hands, got to make sure we're wearing our using hand sanitizers as much as we can, and staying 6 feet away from people.
Yeah, indeed. Well, IU Health is going to be at one of our events coming up on October the 20th, I do believe, isn't it? Isn't it the 20th or that next Tuesday? I don't have my calendar here in front of me. But anyway, free flu shots. We're going to be behind a series of free flu shots with IU Health. And we're excited about doing that at one of our food and meal giveaways out at the Indianapolis Urban League. That is going to be fantastic. And the great thing about flu shots that I've always liked is that they are usually low cost or no cost or free. I mean, there's basically no expense to it. It's just a matter of getting it done. And you know what else? They don't hurt.
They don't hurt. They actually don't hurt. I didn't even feel mine this last time, which I was surprised. I didn't baby.
Are you? I didn't either. And I tell you what, I was talking and then they were putting I said, where are you putting the Band-Aid? She said, we're done. I'm like, well, I didn't feel anything, So yeah, love it. So it's harmless. It's going to work. And we really want people to embrace this, especially heading in. Now, at what point, very quickly, I know I always say I'm going to ask the last question. Is there an optimum time to do it, or can you get it done anytime during the flu season?
You can get it done anytime. I'm telling my patients this year, though, because COVID is increasing, go ahead and get it now.
Get it now.
Especially we've already seen the positivity rate increase with COVID. So if we go ahead and get it now, we'll put ourselves at the best chance to make it through flu season and this COVID season.
So how long are we good for if we get it now? Are we good all the way into May?
Normally you're good until the end of May.
Till the end of May. I love it. I love it. Dr. Tamika Dawson, thank you so very much.
Thank you.
And you have a good rest of the flu season. Hopefully we can get hundreds and thousands and millions of people vaccinated with this campaign that we have.
I hope so. I hope we can get as many in our community as safe as possible.
Absolutely. Thank you so very much, Dr. Tamika Dawson.
Thank you. You have a great day.
You too.
Thank you for having me on.